Many jazai khairan for everybody who has joined us today for this stakeholder meeting with Bismillahir Rahmanir Rahim. We begin. And this is the 5th stakeholder meeting in our series, and we will inshallah have one more right before Ramadan on April 11th. So I'll just do a quick review of the meeting format. So we begin the meeting with the proper intent with the dua, and Muhammad Saifullah here again is with us, and he will relate the dua to us, inshallah. We will do some project review and updates. In fact, today we will do a little project review instead of updates, because I have received feedback from many folks in our community that there is still some confusion about the project, and some of the messages that we have shared with us before, but with everybody before, may still not have the right clarity. So inshallah, we would try to just review the objectives and such. We use every meeting, we discuss one PCOR principle. So today's PCOR principle is actually honesty and trust, because Nasir Bhai was the speaker for me on honesty. And when I asked him, he said, honesty and trust goes together. So I said, you're the authority on this. I'm going to take your word for it. And alhamdulillah, it has come. I personally like today's material, and inshallah you will too. So each guest speaker will actually explore this PCOR principle and its applicability as to how it stands with respect to community health. And after that, we would have a Q&A session with all the members in the meeting. So I'm going to ask now Brother Muhammad Saifullah, who is our khatib, to recite or start with the dua.
Sure. Assalamu alaikum. Can you hear me?
Yes, we can hear you.
Okay, excellent. Good afternoon, everyone. As Ms. Fatima stated, I'll start us off with the prayer. And the idea with these two specific ones is that when you put your trust in the Lord, when you turn to Him and hold on to the truth, then we will become honest and trustworthy.
Inshallah.
Inshallah.
So the first one is ربنا عليك توكلنا وإليك أنبنا وإليك المصير. O our Lord, in you alone we put our trust, and to you alone we turn in repentance, and to you alone is our final return. And the second one is ربنا لا تزغ قلوبنا بعد إذ هديتنا وهب لنا من لدنك رحمة إنك أنت الوهاب. O our Lord, let not our hearts deviate from the truth after you have guided us, and grant us mercy from you. Truly, you are the bestower. Ameen.
Ameen. And Jazakumullah khairan, Saif, for the duas, and may Allah guide us and support our efforts, inshallah. So just to review the very basics of the project, that this particular project is called the EMPART project, equipping Muslims with PCOR-based, action-oriented research tools. And that's the acronym EMPART stands for. So we are hoping to equip Muslims with PCOR-based and action-oriented research tools. So we will actually see what PCOR, some of the PCOR tools are. We'll get it introduced or reintroduced again. So this toolkit actually is primarily a patient is being introduced to build patient-centered research capacity in mosque communities. And we would, I have actually, after the meeting, we will send out the slide sets and the recording for this meeting. By the way, this meeting should be recorded. If Masood has not started the recording yet, I would request him to start.
It is recording.
It is recording, and everybody is okay with that?
Inshallah.
Okay, Jazakumullah khairun. So this actually has links embedded in there. So if you like to reference it later, please go ahead and work with the links that we have embedded in. So why MOSQ-PCOR toolkit? We have a large MOSQ community within the United States, and we are a substantial minority, and we make up pretty big numbers in some of the cities in some of the major metropolitan cities within the United States. And knowing that, we actually have a considerable vested interest in the healthcare and community health sciences. So in order we needed a toolkit, or we needed some kind of framework to actually engage our community with the community health research. And you see, with the community health research, the patient is the main focus of the entire research. And in order to connect these two, the translational sciences with the MOSQ community, or the community health research with the MOSQ community, we really needed a mechanism to create the culture of research on community health. And therefore, MOSQ-PCOR toolkit came about. Now, this MOSQ-PCOR toolkit actually has, here's a list of contents. So it describes the Muslim MOSQ context. It describes what exactly is the MOSQ community. And then it describes how to do a PCOR study, patient-centered outcomes research study. It includes planning, conducting, and disseminating. And all of this is going in within the context of MOSQ communities. And at the end of the toolkit, we also have some suggestions for the implementation and sustainability of the patient-centered outcomes research projects. Now, the MOSQ-PCOR toolkit actually has its roots in one of the older projects, which was right here, engaging Muslim. Sorry about that. Shouldn't have clicked on it. The slide sets have many different links embedded. So you just saw that. So I hope I won't click on the next one. Again, going back to the eMarch, that was the study that was led by Dr. Padilla when he was at the University of Chicago. And this was about engaging Muslim Americans for research on community health. So that was funded by the Institute of Patient-Centered Outcomes Research. It's at the federal, that institute is actually at the federal level, but it's an independent institute. We have actually talked about that and its methodology extensively in the previous meetings. That 2 years worth of study led to a conference in 2019. And at the conference, we introduced the MOSQ-PCOR toolkit. This MOSQ-PCOR toolkit now needed to be disseminated. And this particular study, which is equipping Muslims with the action-oriented research tools, is actually that effort where we take the MOSQ-PCOR toolkit, and now we are engaging and introducing this toolkit in larger Muslim community within different MOSQ settings, as well as to the different stakeholders. However, I'll warn you that this particular toolkit is not actually for lay people because of the methodologies that are involved, because of the project management tactics that have been involved, and because of different language settings that it requires the person to understand and carry out these projects. So it is for people. We'll talk about a little bit more about the stakeholders for the MOSQ-PCOR toolkit. So we are also hoping that at the end of this particular one-year study, actually would end up with another conference in September, inshallah. We have, it wasn't part of our original project, but COVID hit. So we may not have this conference in person, but inshallah, we hope to have this at least virtually. Now, the objectives of the art, it actually fosters a culture of research and community health. And there are about 5 basic objectives. It builds capacity by introducing the PCOR toolkit to the MOSQ board members. It establishes a network of MOSQ PCOR community health workers through a training program. And we actually trained 10 community health workers already with this MOSQ PCOR toolkit who are working in different MOSQ settings. We have asked the community we ask the community and help, and what it does is this mosque PICOR toolkit or EMPART project help the mosque community members with their issues through virtual outreach, which is being done by the community health workers. And then we would conduct town halls at 5 different locations to involve policymakers in our work. And essentially, lastly, it establishes an advisory committee vested in mosque health priorities. So as you see that this is a collective effort. So the EMPART team is not only the project team, but this takes different types of community stakeholders. We have community health workers, we've got mosque board members, we have subject matter experts, and actually without the subject matter experts, we are recognizing that many of these things would be very loose and we may not have coherency, because the project team is very much focused on the research methodologies and the research mechanics and the project management mechanics. It is the subject matter experts that really provides us the glue to the disciplines that the community health largely embeds. For example, information technology comes in, legal matters come in, you have communication, you need communication experts that are embedded within the communities to disseminate this message. So our subject matter expert team really is key in gluing all of these factors together. And then the public officials also people who are oriented towards or have people who have political orientation would also be a big part of this project, because they can link public officials that are interested in the health disparities of the Muslim community. So who are our community stakeholders? Again, mosque board members, subject matter experts, people who develop and implement community health programs, professionals needing training in community health discipline. And this aspect, or this part of professionals, really is pretty large. It includes physicians, it includes healthcare administrators, it includes social service workers, as well as nonprofit leaders. But primarily these professionals are their leaders in their communities and in their professions who are interested in the community health discipline. And lastly, the public officials who are wanting to address health disparities. So EMPART essentially is not exactly for everyone, but it's for that subset of relatively stakeholders that are vested in our communities. So how does EMPART helps community stakeholders? EMPART helps build capacity for community stakeholders, people and organizations in the following ways. And again, some of this I have highlighted before, but I want to highlight a couple things here, these 4 points here again. Mosque board members, because we introduced them to the PICOR toolkit. We train mosque members to become community health workers. So although we have trained a set of community health workers, the community health worker training program is out there on the YouTube, and any community member who's interested to become a community health worker can actually review these materials and contact us to become a community health worker for their mosques. The third thing is that we provide research and materials to the mosque boards so they connect with their public officials. And lastly, why are we interested in all of this? Because this brings in dollars for the community as we highlight the community's health needs. And these community health needs in our communities really mean issues that our new immigrants are having. Employment, educational issues. These are some of the issues that we have noticed and are highlighted so far with our EMPART project. The subject matter, EMPART is guided by our communities experts. As I told you, we have 3 separate teams: data, systems. Systems actually involves 2 things. It's information systems technology as well as healthcare systems. So far we have these excellent, wonderful and distinguished folks with us who have agreed to serve as the subject matter expert advisory board to us. Dr. Kamal Adrawi, he is from University of Illinois, Chicago. Brother Imran Khan, the information technology expert. He's has worked in multiple high-profile organizations like Accenture, and is also a founder of Gem Solutions. Hira Mirza, she works for the CMS, the AC and the government programs, and Mushira Khan, we will hear from her today. She has worked with JACO, just recently moved herself into the community health discipline, but was a compliance research methodology person with the Joint Commission. And then lastly, Shazia Bakhsh, who is a lawyer and has helped us with our terms and conditions and the policy. So I really want to make a note to especially thank Sister Shazia Bakhsh. She is a founder of Bakhsh Law Offices, where she practices family law, guardianship, and consumer advocacy. She has a keen interest in social justice issues within mosque community. Now, it's interesting. Shazia's background is very interesting. She has a bachelor's of sciences degree in biology, so she understands the community health aspects deeply. And then she went on to receive her Juris Doctorate JD degree from Northern Illinois University College of Law, and now she is practicing as a lawyer. She has kindly extended her expertise to review our online terms and conditions and privacy policies for the EMPART project. So when you go in and you see that there is a lot of materials on our website, and it has been under her guidance that we have put together our terms and conditions and the privacy policies. So once again, Sister Shazia, we thank you very much on the entire team of EMPART. So why PCOR principles? Just want to iterate that in order to understand and implement patient-centeredness, we need to understand what the patient-centeredness is all about, what are the basic values and principles that the patient-centeredness is being guided by. And in order for us to adopt the patient-centeredness attitude, we would have to also adopt these values and principles that would help us guide our behavior when we are implementing the entire attitude of patient-centeredness or working with research on community health. So I would again encourage people to go in and review this document on PCORI's website, which is the engagement rubric, and it has lots of detailed materials. So just to review, by today, we have covered pretty much all the PCOR principles. The first one was reciprocal relationship, co-learning, partnership, transparency, honesty, and trust. And honesty and trust is today's focus, inshallah. So, while we were organizing this workshop and this meeting, Nasir Bhai has provided a lot of help. In fact, I focused on PCOR principles because I have taken Nasir Bhai's workshop 4 or 5 years ago. And that one workshop really changed the way I worked. And it was amazing how I became a lot more effective in my own ways. And when I read about PCORI principles, this resonated everything about what I was taught at that workshop by Nasir Bhai. So I brought him in. I said, "This is your forte, Nasir Bhai. You got to tell me how to do this." So he gave some ideas, and this is next 2 or 3 slides are really wonderful materials that have come out. Thank you, Nasir Bhai, again. So trust works at 2 levels, at micro and macro. So at micro level, it's one honest person. So we see all of these honest people out there, and all of these people put together or come together to become an honest culture. And that's what happens at the macro level. So unless we have that micro level, trust will not translate into a macro level. So we are going to work with both of these levels today. Micro level will be presented by Nasir Bhai in a mathematical equation, really phenomenal equation. And then Dr. Mushira would talk to us about the macro level and do that. So just a little bit of an overview, and I found this website pretty interesting. And if you actually go to the website and go to the different, on the lower part of the the figure here, it has 1984, and then it has 2014 on the other end. So if you take this little ball and go to different, put a different slides, or maybe I would just do this online. It would be better. Yeah, this would be better without me explaining it. So it would tell you how trust has changed over the period of time. And I found this very interesting. So this is 1998 and 2004 and then 2009. So if you look at between, my internet is acting up.
To get out of the slide.
Oh, I see. You're not
seeing the screen.
I see. That's right. That's what happens sometimes. Share. I would have to reshare it back. Okay. So if we take this little ball and move it at different parts, it would tell us how the trust has increased or decreased in different communities. And look at 2009, look at China in 2009, see where China is today. This is 2014 China. So it has become a very high trust culture, and we have become a relatively low trust culture as compared to the previous years. So, what that means is that 40% of the people are actually think that we can trust each other. So that we got to change that somehow. This would be not very conducive to our environment, or especially in healthcare, because healthcare is all about trust. These relationships are totally about trust. So let me go back to our screen here. And move forward. One of the tools that I found extremely helpful is that trust at the micro level, it's equal parts, trust is equal parts character and competence. You can look at any leadership failure and it's always a failure of one or the other. So basically what we are bringing in through the EM part is actually competence. We are giving our community the tools that would help us bring that expertise to run research in community health, while the community and the stakeholders have to bring in the character, and we work together to accomplish these health disparities in our communities. So with any further delay, I would love to invite Nasir Bhai, who obtained his master's degree in management from Yale University. He is taught as a faculty member at LUMS, Lahore University of Management Sciences. By the way, LUMS is actually one of the top 100 universities in the world. So it is highly regarded as one of the most prestigious universities around the world. And he's also currently a part of their adjunct faculty. I believe one of the person has joined just because of LUMS on this call. Thank you, Inambai. He specializes in designing and conducting customized training programs for major for-profit international organizations. Like he had a long list. I actually shortened it down. So you can see all the different names: Navy War College, Nestle, Unilever, Abbott, GlaxoSmithKline and Beecham, Shell, Indus Motors, Mobilink, Pakistan Cricket Team, and National Cricket Academy. I found that very interesting. His signature personal development workshop program is called Building Beautiful Minds. So Nasir Bhai actually gives out these workshops in different mosque settings with ICNA, and has been really transformational workshops for our community. Today, he will share his famous mathematical equation that has the power to implement trust. And now I'm going to go to Nasir Bhai's presentation. Can everybody see or is the,
Yes.
Can everybody see the slide presentation?
Yes.
Okay, very nice, thank you. Go ahead, Nasir Bhai, please. Jazakumullah khairan. for joining us.
Actually, you need to share that slide. The slide deck we are seeing is yours.
Okay. Thank you again.
And now we can see it.
Okay. Jazakallah khair, Sister Fatma, for such kind words. May Allah subhanahu wa ta'ala bless you. Assalamu alaikum, everybody. Rabbi shrah li sadri wa yassir li amri wahlul uqdatam min lisani yafqahu qawli. Rabbi zidni ilma, Rabbi zidni ilma, Rabbi zidni ilma. This program on truth and trust, it was very kind of Sister Fatma to think that I can add value by facilitating it. Can I have the next slide, please? Sister Fatma, can I control it from here? Okay. Next
I
one.
would have to make you the host. If you're okay with it, then I can do that. Let me stop sharing. I think I need to stop sharing. How do I do that?
As long as I can click my way through it.
Yeah, let me make you the host. Oh no, I think I know how does this happens. Hang on. Oh, there it is. Stop share. And now I can have you as Masood, can you give Nasser Bhai the
I actually have given everybody like multiple participants can share simultaneously. So
okay.
If Nasser Bhai would like to share,
okay. Nasser Bhai, if you want to click on share a screen, you can share it.
Yeah, but okay. Yeah. Let's see if this works.
Your screen. Yes.
There you go. We can see it.
We can see yours.
Okay, let me share with you how I got into this honesty and trust business. Basically, many years ago, I started thinking about how when you walk into an organization, the first people you meet are the security guards or the reception at the desk, and then you walk yourself into different departments, people, and then the CEO eventually. And my challenge was that everybody, Allah subhanahu wa ta'ala has given everybody a body and a brain, and how do people differentiate into their jobs? And after a long time, or after some thinking, I figured out, I'm sorry, it took me a while, that people have different qualities. And Allah subhanahu wa ta'ala has a very interesting way of assigning people to jobs according to their qualities. So as soon as you start walking from one person to a couple or three people or four people, one of the qualities you need to do well is honesty with each other, with yourself, and the ability to trust others. And without honesty, you cannot build trust. So I asked myself another question: why is honesty and trust important? One of the best ways I can explain is if you don't have honesty and trust, then your closest relationships will break down. And over a period of time, you'll start experiencing the results of dishonesty and distrust, and things will fall apart. And you see this happening more and more in our societies, whether it's in Pakistan or America. And like sister, that slide that Sister Fatma was sharing, I think I'm going to ask her that it's a very powerful slide, which goes from, year X to year Y. And over a period of time, you will see that countries that are progressing, there the trust level and honesty level will be rising. And the countries that are in disarray, the honesty and trust level will be in decline, both at individual levels and like she mentioned, micro and macro levels. So what happens, we all strive to be good at what we do. Some of us are good, some of us are not so good. So for those of us who are not so good at what we do, and also the trust level is low, it is total, absolute disaster. The more we work, the more we try and get things done, somehow things mess up, and we start blaming others for it. If you are low in excellence, mediocre, and some people are very highly trustworthy, there's a small minority which falls in this category. But unfortunately, for higher levels of work, you can't trust them. For low-grade work, you can go to them, and inshallah, they'll be there for you. Then there's this people who excel at what they do, but somehow you can't trust them. They will sell their soul or their science to the highest bidder, and you will be left high and dry. The people we really want to have in our lives are people who are trustable in their character and excellent in what they're doing. One of the things which I challenge people or request them is, as a facilitator, is to see which quadrant they fall in, and then to develop themselves into the fourth quadrant, which is trustable and excellence. Unfortunately, when I look at in Pakistan, we are mostly in the disaster zone. Even America lately, since COVID and since the previous 4 years, you have seen people, unfortunately, doing things which you never expect Americans to even think about. For example, the whole thing about, I think it was January 6th, when the Capitol Hill was taken over by mobs. This is a sign of trust breaking down. There are other things like all this shooting of minorities, suicide by police people, so many indicators of the trust level falling. So I think regardless of which way you are, we always have room for improvement. And this quadrant where people are trustable and excellent, it's a never-ending thing. You have to keep on improving, working upon it. Now, when you think about honesty and trust at the micro level, then the most important person is I, in my case, you in your case. And we all have some boss we report to, or in our house, we have our spouses, we have reportees, we have children, we have peers, we have relatives, and we have customers we serve to make a living. Now, in all these relationships, whether they are personal or professional relationships, we strive, or we pray that we have a boss we can trust, we have reportees we can trust, we have peers we can trust, we have customers we can trust, so that we can have a relatively, I'm searching for a word, relatively effective relationships. Now, this is the challenge, that even if by a huge stroke of luck, everybody around us is honest and trustable, life would be as if living in heaven. But what if everybody is trustable, and I am not? And then it's a huge disaster, because I'll destroy everybody around me. So when you look at life like this, then you say, okay, the second challenge is, can I control my boss, my reportees, my peers, my clients, my family to be trustable? And one of the things you will figure out for yourself, or when you talk to people, is you can't control them. There's only one person you can control and make trustable, and that's yourself. So once you understand this, you ask yourself, how much do you trust them and why? And on a scale of 1 to 10, different people will come up on different scales and for different reasons. And the second question is, how much do these people around you trust you, and why. And everybody would rate you differently and according to different things or qualities they see in you. So the trust or trust deficit depends upon the presence or absence of certain qualities. Now, when I started working on this, one of my wonderful teachers, he taught me this formula, which Sister Fatma thinks is very powerful. And I think it's actually very interesting. In this formula, you say, in my case, when I'm facilitating this program, I is me, you is all of you, is equal to we, which we is the value which we get for coming together in this webinar. Now, the greater the value, the more attentively we will listen to each other, respect each other, care for each other, regard each other. But as the value deteriorates, you will see people yawning, moving back and, shutting down their minds and eventually saying, oh, this is rubbish. I can walk away from it. And in family life, you will see divorces, and in professional life, you will see people being fired when the value is negative. As long as the value is positive and it keeps on increasing, you will have better and better relationships. And one of the things which you will find is that in this equation, using Stephen Covey's formula for controllable and uncontrollable, there is only one person you can control in any relationship, whether it's with your parents, with your spouse, with your children, professional relationships, and that is I. I am 64 years old. I still can't control my spouse, my in-laws, my own mother, my children. I can't control them. They're sitting in America. I can't control people who work for me. I'm so sorry, but that's the truth. Only one person I can control, that's myself. And this is sphere of influence. And the you and we, I cannot control. But having said that, I want my relations to be rich. I want my relationships, especially people I love and care for, I want to be close to them. In professional life, I want to have a good relationship with my boss, my reportees, my peers. I want to have excellent relationship with my customers. So how do I make that happen, whether it's micro or macro level? The first thing is intention and attention. The more sincerity you have in you towards others, the greater will be the impact of on value. People love sincere people. People love if they have a feeling of sincerity, then people would like to trust you. The second thing is, what are you focusing your attention on? Are you focusing the attention on the controllables or the uncontrollables? The challenge with Stephen Covey says is that whenever you have to decide between controllables and uncontrollables, focus on the controllables. So the second and third controllable is honesty and integrity. Honesty is very simple. It's like speaking the truth. And all my life, I have tried to be honest, but somehow, it was like an 80-20 game. I tried to be 80% time honest, and 20% of the time I would try and fudge and wriggle out. And then I met this wonderful person who was a guest speaker in my workshop, and he had risen from the lowest level in an insurance company to become the CEO. And he came there, and the participants in my workshop asked him what was his secret. He said one thing, that I never lie. And the participant said, how is it possible? You rose from such humble beginnings and you went to the CEO. So he made a very interesting answer. He said that, listen, I have a very small brain. And he raised his hand like this to show that the palm of his hand, that this is the size of my brain. And he said that if I make one lie, then I would also increase it to 10, because, you know, what is the difference between 1 and 10? And if I make 10 lies a day, that is 300 lies a month, and which is what, about 3,000, what, 3,600 lies a year. And he said something very interesting. He said, my brain is too small to remember so many lies. It'll overheat and collapse. And I said, what a wonderful story. And what a wonderful way of explaining it. And I went home and I said, you know, I have to start. And they said, and then he said something very interesting. He said that if I lie to my customers, I'm so senior that like wildfire, everybody, all my customers would know that he has been lying to somebody or the other, and I will lose all my business. So I went home and I asked my wife that, you know, is it possible that we start being honest? And she's very smart. She said, okay, but does that apply to you or to myself and the 2 children? I said, listen, you know, I would like us all to be honest and have integrity. So she said, then in that case, when somebody calls and we still had, at that time, we didn't have the cell phone. We still had that wire phones. So she said, then when somebody calls and you don't want to talk to him, will you ask the children to say, tell uncle that Abu's either sleeping or he's away? I said, well, I will desist. So she said, fine. So we started living by this principle, and 2 or 3 things helped me in understanding the power of honesty and integrity in family life. The first one was when we had internet, and we had these pop-ons coming, which were slightly vulgar, and my children were in the teenage, and everybody told me that I should have these the computer with the internet in a public place, so my sons who were both in their puberty would not go to the wrong websites. So I had a meeting with my children and I said, listen, you know, we are going to have this and I'm going to trust you. And if you want to say where your father goes, you can go into my history. You can look at your mother's history of the websites you visit. And I would be grateful if we have honesty and you desist. So I never got any reason to complain in those very dangerous years. And then both of them went to America to study. And Khalid, my eldest son, he rented an apartment where he had to pay a security deposit, which was non-refundable, and it was good, I think, $800 or $1,200. The building had a change of management. The owner died and the children sold the building. And the new management didn't know this non-refundable clause, and they sent Khalid a check for $1,200. And Khalid said, they are so stupid. Don't they know that this is non-refundable? And he sent the check back. I had tears in my eyes. Living in America, you know, a new employee, a young boy with a very low salary, salary, and he was showing us the result of a decision we had made 15 years back, 18 years back. And I am thoroughly convinced honesty and integrity brings trust in the family. And at the end of the day, this family is so powerful, so important, that if you share honesty and integrity in the family, in the long run, inshallah, you will reap dividends far beyond your imagination. Even today, I'm being checked by my sons if there is any shade of absence of honesty or integrity in my dealings, and they remind me of the lessons which I taught them. So my children have become my teachers in this, and sometimes even my wife is trying to tell me how to do things better. But so it's like we are all there for each other to support us in becoming better and better. I think the family is where lessons in honesty and integrity start. That's where we learn how to develop the power of trust. So, and always remember, I remind myself that all my life, I had been telling my children that honesty and integrity are important, but only when I started practicing them and they saw it in my dealings did they imbibe these values. And I'm still not very good at it, to be honest. But Alhamdulillah, let's say on a scale of 1 to 10, I'm on 7 or 8, maybe trying to reach 10 and hoping that before my expiry date, I'll get there. The third thing is empowerment. This is very powerful in developing the power of trust. It actually stems from honesty and integrity, but it is even greater than that. Empowerment is the process of turning victims into masters. So when there's actually the process of this transformation is very powerful. It is shifting a person's attention from what they're getting to what they should be giving. Most of us are focused on what we are getting, and in order to get more, sometimes we misstate, sometimes we lose track of honesty and integrity. But when your attention is on giving, then you don't have to lie because you're giving, and you don't have to lose integrity. Giving is very powerful in improving your honesty and integrity. Best thing about master leaders is that they empower. They unleash the capacity of the other to give. Empowerment is not about being nice or about tolerating mediocrity. It's about pushing people to bring out the best in them. This particular section I learned from my teacher. His name is Sheikh Ibrahim. He is a revered South African Afrikaner. His South African name was Etsko Skeetma, and he does this workshops on care and growth model, one of the best leadership models I've ever seen. So in this process, he says, victims are always have gripes, they're complaining, masters have goals. So whenever you see a victim, he'll be crying, and unfortunately, when you sit in the community, you will find more people with gripes, very few people with goals. And that should tell you the difference between victims and masters. A leader's job is to help the victim to make them masters. And how do you do them? You turn their gripes into goals. The process which is taught, I think this first point is taken from Stephen Covey's 7 Habits. Listen, seek to understand, not to be understood. So when somebody comes with you with a gripe, just listen to them, let them vent it out, and then help them in rephrasing their gripes as goals. Then force them to brainstorm to design an action plan to achieve the goal. And the last thing you need to establish is accountability. You force them to commit that they will work for the goal. You will always be there to help them in supporting them, but it's not your job to do it. In the process, you will find that people will become stronger, they will become better, and they will the honesty, integrity level, and the trust level will increase. This is so powerful that I always remember that in Medina there was a time when people would come out to give zakat, and there were no takers there. And what had happened was that the poor people who used to take the zakat, they were still poor, but they remembered the hadith of Prophet ﷺ that the hand that gives is better than the hand that takes. So they just transformed from victims to masters. And they just changed their hand from this to this. This was very powerful for me, the process of empowerment. The next is looking for good in others. This is something which truly destroyed my management theories. Throughout my management theories, intelligent people are intelligent because they can look at the weakness of others, point them out, and demolish and destroy them in the process. So the best manager, best leader was the one who could look at you and tell you your weaknesses and tell you, that you should improve, otherwise you won't be worth anything. I was sitting with one of my teachers, and he shared this this point from the life of Prophet ﷺ. He said that if you read his biography, throughout his life, he never criticized others. But his highest level of criticism was that, listen, you are wonderful, but what you're doing is not so good. So why don't you change this, and Allah and his Prophet will be delighted with you. So that was his height of criticism. But when he was looking for good in his companions, there was a man called Abu Bakr, and he said, you are my Siddiq. And this Siddiq is the highest level. There are no other superlatives beyond being a Siddiq. There was a man called Umar who was very smart and very quick, and he could reach the bottom of any issue in seconds and figure out what needs to be done. And he said, you are Farooq. You can distinguish between good and bad. Then there was a man who was the Warren Buffett of his time, Hazrat Usman, and he said, you are Ghani, you're so generous. And then there was Ali. Rasulullah Sallam shared so many good qualities in him. And one of them, which I liked, was Asadullah, the lion of Allah subhanahu wa ta'ala. And the second one was Abu Turab. Hazrat Ali was not a trader. He was more of a physical man. He would do physical labor to make a living. And often he was covered in dust. So he said, you are Abu Turab. Now, two of them were his father-in-laws, and the later two were his son-in-laws. So you can excuse him for, looking for good in them. But how many of us look for good in people who serve us? Hazrat Bilal used to serve Rasulullah Sallam and his family. And one day Rasulullah Sallam said, Bilal, what do you do? I heard your footsteps in Jannah. He was giving him the good news of Jannah to somebody who was serving him. Hazrat Bilal used to wear these wooden clods, and they would do click, click, click. And Rasulullah Sallam said, I heard these clods in Jannah. And lastly, we all have people we don't like, people who have demolished or destroyed us in certain situations, and we never forgive them. And we call them enemies. Khalid bin Walid was the only person to defeat him in war, in Battle of Uhud. And Rasulullah Sallam said, you are Saifullah, the sword of Allah. What was Rasulullah Sallam sharing with us? That try and think that all these people in Islam, they were not from one family or one community or one tribe. They were coming from very diverse backgrounds with extremely different abilities, with different outlooks in life. And Rasulullah Sallam was trying to bring them under one umbrella, almost like a community in America, almost like a community in America. And the only way he could, one way he did that was to build trust, was to look for good in them. Why? If you look for good in others, they trust you. When you look for weakness in them and you keep on telling them their weaknesses, people move away. And after a while, there's distrust, they start having negative thoughts, and they ferment into rife and little small wars. And eventually, you have bloodshed, like civil wars in Islamic societies. I mean, we have had our share of them. And Rasulullah Sallam brought his community together. And if you look very closely at the state of Medina, there were about 200 to 500 people living with the Prophet ﷺ, who was his close companions. And he found something good in each and every one of them. And they developed those qualities and joined them like this. And eventually, they became so strong, they demolished two superpowers, the Roman Empire and the Iranian Empire. It was this cement which brought them together. Even today, you go to anybody and you look for good in them. After a few days or months, they will melt like butter and chocolate in the sun. The ultimate test of this sunnah is, and I actually, I don't know if you want to hear this or not, but if you want to really try the sunnah, the power of the sunnah, for those of you who are married or you have close friends, go to them and one day, like to your spouse, and say, okay, you know, when I was getting married, there were so many proposals, but you know, I'm so grateful I married you. And you know, the spouse would be just like, hey, where's this coming from? And then you look at the children and you say, you know, you have done such a fantastic job in raising them. I'm really proud of you. And while the spouse is trying to absorb all this, the last, you know, icing on the cake is, you know, they have so many good qualities from your father and your brothers. You know, I'm truly grateful that I married you. And that day, you know, you will be treated like royalty for the next 1 week or so. And if you want to commit suicide, you know, just get up and do the reverse. And I don't promise you, you know, nobody would insure you after that. So always look for good in others. Make sure that, you know, in any situation, you look for good in others. And you will find, I actually tried in my personal and professional life, and over a period of time, I found that the lowest thing is you just zip it up. You don't say anything. But the highest thing is you say something good. So I have some strengths, some weaknesses. You have some strengths and some weaknesses. And this is the quadrant. If I look at your weaknesses and you look at my weaknesses, there's total disaster. We will destroy each other. That's what's happening in our communities. The mosques, you know, as soon as they start prospering, one faction says, we want to build another mosque. It's a disaster. I may have weaknesses and you may have strength. And if you help me out, I'll be grateful. That's very nice. I may have some strength, you may have some weaknesses. And if I help you out, you will be grateful. But the best community building is when I look at your strengths, you look at mine, we join hands like this, and we keep on helping each other. We have synergy, we have respect, we have cooperation. So this, again, try and go into this fourth quadrant, and then you will see the results. It won't happen in one day, but after a while, people will start respecting you, cooperating with you, and your efforts will start bearing fruit, inshallah. Focus on developing others. Now, this is very powerful. Prophet ﷺ, throughout his life, he developed his people. And this is what he did. In business, we are taught to use people to achieve goals. That is what the Roman Empire was doing. That's what the Iranian Empire was doing. The emperors were using people to achieve their goals. And this is what the Prophet ﷺ did. He used goals to develop people. Doing 5 salahs a day was a goal. But the discipline I got after 1400 years, I still thank Allah subhanahu wa ta'ala and the Prophet who taught me. The Ramzan is coming. Now, Rasulullah taught us to use the goals of Ramadan to develop people. Hajj, using goals of Hajj to develop people. Hakukullah, use goals to develop people. Hakukul ibad, goals to develop people. Islam is about developing people. Unfortunately, there are also people who use people to achieve goals. So focus on Islam, the goals of Islam to develop yourself and family around you. See how powerful it is to go hungry all day long and still have gratitude for Allah subhanahu wa ta'ala, to be able to pray 5 times a day, have gratitude, to eat your food, have gratitude. So use goals. The next thing is gracious manners. These are very powerful. Why? Especially for people who are weaker than you, your spouses, your children, people who are poorer than you in the community, be gracious with them. Allah is very close to people who have gracious manners. Prophet ﷺ used to say that I embody the best gracious manners. And I think that's one of his sunnah, which we have sometimes we are very good in gracious manners with people who are more powerful or richer than we are. But somehow when we look at the downtrodden, we forget our gracious manners. So practice them, practice them. With your children, if you want them to do something, say please. When they do it, say thank you, give them a hug and a kiss, so that they know that they're being appreciated. And last thing is dua. Power of dua. I would share with you a small incident which happened to me at LUMS. One of my very close friends, Dr. Zain Jaffrey, I heard he developed lung cancer a while back. And I was thinking of going and visiting him. When one day, when I walked out of the mosque, I saw his smiling face. So I said, Dr. Jaffrey, I was going to come and visit you, and you are well. What happened? The doctor had said, given him a few weeks to survive, and I was so happy to see him walking around. And he said, okay, if you walk me to my office, I'll share with you what happened. So I said, okay. And we started walking. And he said that, when this cancer was diagnosed, it was grade 4. And I just had, the doctors gave me a few weeks. And I was given chemotherapy. I was in bed with nausea, vomiting. And my wife came over and he said, Zain, you have a few days. We have no place to live. We are living in Lahore University's flats, and they will be available to us for 6 months after you. Where do I take the 2 boys who are in university? So he said, I had no answer. I just cried, and my wife walked away with tears in her eyes. And I started talking to Allah subhanahu wa ta'ala. And I said, I am ready to come to you. I have served you all my life, but please help me with my wife and my children in finding a house, a home of their own. And he said, I kept on repeating this dua again and again and again. Next week, when he went for his checkup to the doctor said, Jaffrey Saab, I don't know what's going on, but your cancer is gone. And it seemed that it was never there. Jaffrey Saab jumped with joy. After the weakness was over, he dressed up and went to school, the college, and like wildfire, everybody knew he's back. And the vice chancellor, Dr. Zahoor, who was a very good friend of Jaffrey Saab, he called him, and Jaffrey said, I'm coming to see you. After salutations, out of the blue, Dr. Zahoor says, Jaffrey Saab, have you made your house? He says, well, I have this cancer. I can't do it. I wanted to do it after retirement, but now I can't do it. So Zahoor Saab says, do you mind if I help you? He said, fine. How are you going to make it? Oh, I have these 2 pieces of land. I was going to sell one and build it on the other. Dr. Zahoor immediately calls a real estate agent and says, well, we have this plot. What's the price? He offered such a good cash price. They closed the deal immediately. Next thing, Dr. Zahoor had a university architect. He said, this is my brother, and he wants to build a house. Can you do a turnkey project for him? And, just do it and consult them. Within 6 months, Jaffrey Saab had keys to his house. And he was delighted, but when he went to his next visit, the cancer was back. And he was given chemotherapy, and he was miserable. When he went to came home, he said, I had nausea, fever, and vomiting. And my younger son came and he said, Abba, I'm looking for a job. I don't know what to do. And Jaffrey Saab closed his eyes and he started supplicating to Allah subhanahu wa ta'ala, please find him a job. He's my son. I'm coming to you. Can you help him out? Now, this is what happened. There was this mobile company cell phone company in France. They needed a young engineer. They generated a job description on the net, and it jumped from some different websites, and somehow it jumped into this boy's mailbox. And with sheer frustration, he filled it up with zero hopes of getting a job. And after a few weeks, he got a letter saying, young man, you have been selected. Your salary will be in euros, 10 times greater than he expected in Pakistan. And then Jafri Saab squeezed my hand. He said, Nasir, you know, do you have any problems in life, anything you want me to pray for? Because I have figured out a way to please Allah subhanahu wa ta'ala and get things done with him. So I thought, and I couldn't find anything. So I said, Jafri Saab, to be honest, I can't think of anything, but can you teach me the formula? He said, very simple. When you're with your best friend, what do? You talk. And Allah subhanahu wa ta'ala is your best friend, talk. And since that day, I have stopped asking people for anything. Whatever I want, I know where to go. And ask him for trust, honesty, integrity, empowerment, looking for good in others, the power of developing people, gracious manners, everything. And I get it, maybe little, but I'm getting better. Jafri Saab passed away, but he left me with a very beautiful gift. So this is a format I developed that if you practice one quality a week, like intention in the first week, honesty, integrity in the second week, giving versus taking, which is empowerment, looking for good in others, developing people, gracious manners, and power of dua. So after like a few iterations, you will find that your life has changed for the better. In the end, Allah subhanahu wa ta'ala says in Quran, and that man and woman can have nothing but what they strive for. So if you strive for honesty and trust, inshallah, you will get it. And then on the largest macro level, Allah will not change what is in any nation until they collectively make a change occur in what is in themselves. Lastly, my submission is that if we don't develop this in ourselves, who will? And if we don't do it now, when? Thank you very much. I don't know if I have taken too much of time, and I think I have left very little time for my for Dr. Saiba, who is to follow. Please forgive me. So Sister Falkner, this is over to you. I hope it was worth your while.
Many Jazai Khairan, Nasir Bhai, that was an amazing message. Inshallah, we would hope to pass it on and try to live by it and then pass it on, inshallah. So that actually, so I'm going to hurry up with just setting up the stage for Dr. Mushira, and you take these personal lessons and now you develop the trust at the macro level. So living all of the 7 principles every day. And really, if you look at healthcare and when we translate into the macro, at the macro level, we have that trust needs to translate into this particular healthcare system. And this healthcare system is a $3.2 trillion market. And so it behooves us to actually live by these things. Otherwise, there is no way out. We are at 350 million US citizens are at stake, actually. And with a $3.2 trillion market that we all help to sustain. So we are at a crucial point where we need to take action at a micro level as well as a macro level. And Dr. Mushira Khan, she's a research methodologist, and she's going to address health research and critical nature of honesty in applied research to build trust. So now we're going to take it. She's actually, let me tell a little bit about her. She's a health and aging researcher with close to a decade worth of experience in qualitative, quantitative, and mixed methods research. She uses a life course perspective to explore how intersections of gender, faith, spirituality, age, immigrant status, and language proficiency, socioeconomic status, and cultural beliefs and practices shape and affect health and aging in underserved and marginalized communities over time. Her approach to research is formed by an asset-based perspective that values the role of community in public health policy and practice, and builds on existing strengths, resources, and skills within local communities in order to address what matters to them. So we're now going over to the macro level and understanding how numbers don't lie, because numbers don't have room to lie. Go ahead, Dr. Khan. All of it to you.
Assalamu alaikum everyone, and Jazakallah khairan for inviting me, and also for the phenomenal work that the Worry-Free community is doing to address health inequities in our community. It's truly inspirational. It's going to be a hard act to follow after this really wonderful presentation by Brother Nasser. Really learned so much. Thank you so much for that. So without further ado, I'll jump right in. And I hope you can see my screen, everyone.
Yes.
So just beginning with a very brief overview of the core principles or fundamentals of research. And these are honesty, ethics, respect, and integrity. As researchers, we are obligated to be honest in all aspects of research. So be it the reporting of results or findings, the study design, so that's the methods and procedures and our publications, acknowledging the contribution of others, and being honest and transparent, that's important as well, and so on. And also honesty with our participants about what the research is about, what is expected of them, harms and benefits. And an important part of this is obtaining IRB approval, consenting participants, which we refer to as procedural ethics. Then there's a question of situational ethics, the moral decision-making that is more context dependent, which again requires that we are fully honest and transparent. But then there is another key aspect to this, honesty in why are we conducting the research in the first place. So is it just to get yet another publication to add to our CVs? Or is it really driven by a genuine desire to serve the community? So that's really important. The other key principle is that of respect, respecting and valuing our participants as unique and autonomous individuals. And it's important if we want to maintain their trust and confidence. And that is why I really do not like the term subject in research. To me, it's dehumanizing almost, and certainly disrespectful. And then finally, integrity in research implies that we are accountable to participants, to the scientific community, to the public, and to ourselves by being responsible and fair. And let me give you a recent example of how some of these core values can sometimes be compromised with grave consequences. So we all know that 2020 was a year like no other. We were simultaneously hit with, of course, the pandemic, an economic crisis, an environmental crisis, and then there was this reckoning with racial injustice in our country. And the crisis is not over yet. And in the early days of the pandemic, the scientific community was grappling with questions around the coronavirus. So how did it spread? Where did it come from, and so on and so forth. And in the midst of all of this, there was this rush, mad rush to publish research, in many cases without doing due diligence almost. So for example, two of the most prestigious journals last year, the Lancet and the New England Journal of Medicine, retracted two papers on the efficacy of certain drugs for COVID-19 treatment. The authors did issue an apology, but the damage had been done, as both of these studies had, by the time they were retracted, they had been widely cited and shared in the media, in publications and other reports. So examples of this can potentially lower trust and confidence in the scientific community. There was also a host of fake news or misinformation, wild theories around the treatment and prevention of COVID-19. Political messaging was also all over the place, to put it mildly. And this misinformation had consequences, and it resulted in vaccine hesitancy or the unwillingness to receive the vaccine. So this slide here, I want to talk a little bit about mistrust, which is an important aspect of vaccine hesitancy. This slide is actually from a paper we presented at, this was the time when I was working with the Rush Alzheimer's Disease Center. We presented this at the 2019 annual meeting of the Gerontological Society of America. We had done a study on barriers and facilitators to healthy aging among diverse groups in Chicagoland. And we did identify several barriers which find support in the extant literature on health inequities. But if you notice, mistrust was common to all the three groups, so African Americans, Latinx, as well as South Asians. And a lot of it comes from systemic racism and a long-standing history of abusing Black Americans in particular. The Tuskegee experiment is just one heinous example. Among Latinx, it is often due to their precarious and fragmented life situations. Many times the fear and uncertainty brought about by policies such as the public charge rule. And then among Asian Americans, misinformation and reliance on traditional sources of medicine, especially among late life immigrants. That's another key factor that drives this mistrust. So broken trust, and why does it matter? Well, here's one grave consequence. Recent data shows that there is a disparate impact of COVID-19 on communities of color. For example, Indigenous Americans experienced the highest death rate from COVID. It's about 168 out of 100,000 of the population. Black Americans, it was about 137. Pacific Islanders was 112. Latinos, about 100. For Asian Americans, the numbers are a little lower, close to 60, but I would be careful with interpreting this because A, they remain underrepresented in research. We don't participate as often. And B, the data can be misleading because it is rarely disaggregated to account for the many subgroups within this supposedly monolithic category. So it's a grave situation. Having said that, not all hope is lost. As you can see, this is recent data from Gallup, which actually shows that views of the medical profession or the community did go up, and significantly, from 38% to 51% in 2020, which I suppose it's in the later half. This just came out in 2021. So I don't know if this trend will sustain, given what Fatma, you shared and what Brother Narcissus shared. But it's something positive amidst all of this negative news and data that we keep getting. So how do we build or maintain this trust? And one of the examples are places of worship, such as mosques, can double up as vaccine centers. So recently, I was reading about this initiative in Dearborn, Michigan, where Sister Mirvat Kadok helped organize a clinic in partnership with the Henry Ford Health System's Global Health Initiative. And her idea was to vaccinate as many people as possible before Ramadan. So something like this that's really promising. And of course, community health workers are critical to meeting this challenge. They serve as patient advocates and navigators. And then the messaging needs to be not only targeted, but also tailored towards community members. So delivering messages in Urdu, for example, or someone who looks like a member of the community, sharing images or videos of them being vaccinated. And of course, education is key, but also for us as a community, developing this basic ability to filter out or think critically filtering out those WhatsApp messages on COVID-19 or the vaccine that are not linked to authentic or legitimate sources. And a great example of right messaging, and I really encourage all of you to watch this session with Dr. Anthony Fauci that was organized by the American Muslim Health Professionals. It's really informative. There's a link on the bottom, and really great questions and very well facilitated. This was sometime in February, February 11th. And then, sort of building somewhat on what Brother Nasser said when he was talking about synergy and building on strengths. I strongly believe in an asset-based approach and in building trust. I just wanted to mention how, an asset-based approach is so important in addressing some of these issues. And the ABCD framework, some of you might have heard of it. It's much like PCOR, builds on the assets or strengths found in the community, and it privileges mutual trust, cooperation, and collaboration, and really mobilizing the shared knowledge produced in a way that makes sense to the community members and what issues that really matter to them. And it is, again, an important or key principle is built on humility on the part of the researcher, again, critical to building trust. Okay. Oh, I'm not able to go to the next slide. Oh, there you go. And then also, I just wanted to mention, as community members, we need to be honest with ourselves at the individual level. Here's an example. We know that multi-generational living is on the rise. That's data from the Pew Research Center that points to that. People are living longer. So we have what we refer to as the beanpole structure in family sociology. So fewer children and multiple generations living at one time. And also many older parents immigrate later in life to reunite with their adult children. And they are dependent on them. And we know that they face multiple barriers to accessing healthcare. So, it is incumbent upon us, the adult children, to ensure that they, because we sometimes act as gatekeepers, and being honest with what our responsibilities are as adult children. And we know that older adults are the most vulnerable groups. So getting them, access to the COVID vaccine, for example. And on the flip side, there is honesty in getting the vaccine. So for example, we have heard about how some people are jumping the queue to get the vaccine. Part of it, of course, may be due to not really being aware of the current eligibility criteria, but unfortunately, we've also heard stories of people getting the vaccine fraudulently. And again, as Muslims, we want to reflect on this as well. So yeah, that is all. I would encourage you to continue thinking about creative and innovative ways to approach and address health inequities in our community as researchers, as community health workers, as community members, and as individuals. Jazakallah khairan for listening. Over to you, Fatima. I'll stop sharing.
Thank you so much, everybody, for joining us today. And it is both of these presentations, really beautiful work. Nasser Bhai and Dr. Mshira done a phenomenal work, and these three people are literally sitting in three different places and coming together. It actually speaks volumes for the genuine and the true interest that we have in the community health. And in fact, all of you who have joined us today, and I thank everybody for their genuine interest, our subject matter expert team, and all our community stakeholders who are actually putting their heads together for solutions and making sure that we all march towards the well-being together. Thank you again, and inshallah, we will see each other again on April 11th with another topic about about community health and how we find the truth in the manufactured realities of today. So I'm looking forward to that one as well. And thank you again for joining. Unfortunately, we don't have time for Q&A today. However, I would want to leave the floor open if anybody wants to stick around and have questions. We are here. So please go ahead, and the floor is open for questions. And if people wants to leave, I know it's 3:30.
I would like to learn more about this asset-based community development Dr. Mushira Khan was talking about, because I think this is something which is slightly new to me, and I would like to, I don't know where to, any ideas where you find resources to study upon it?
Certainly, Brother Nasser. Yeah,
Sorry,
I can send you links.
We have Mushira Khan and Dr. Rebecca Johnson. Both of them are experts in this technique, by the way. Go ahead, please.
Oh, okay. So we have two experts. Thank you very much. And Dr. Mushira, I think that was a beautiful presentation. And somehow you had made the macro level trust even easy for me to understand and talk about later on. So if you can send me some links about this asset-based community development, that'll be very powerful.
Inshallah, yes, I'll send it. Fatma, if you don't mind sharing, Brother Nasser.
Oh, absolutely, yeah, it would be. But sorry, Mushira, you were saying something. I cut you short. Sorry. Go ahead.
Oh, that's what I was saying. That I'll send the links, and there's a host of information that I'd be more than happy to share. So yeah.
I would like to have something which is simple and like implementable in Pakistan. We have, you know, it's. I hope it's something which is intuitive, which people can think and talk about.
Yeah, no, certainly, and I will send you resources, and they really do a good job of. You know, there's a lot of. You know, because it sort of builds upon this, you know, community members are partners in research. So the language and the way that, you know, infographics are really easy to understand and follow for.
Oh, okay, that'll be very powerful.
Yeah, well versed with research. There is one critique of it, though, that I would like to mention many times. There is this underlying sense that, okay, so governments offload responsibility onto community members. Well, you're the expert, so you know what to do, but you know, there's also articles that sort of, you know, those researchers have come out and said that, no, that's not the case. It's more focusing on strengths of the community and then privileging the community members as experts if they know, you know, what's best for them, and then working together to figure out solutions.
Thank you very much. Really appreciate that. The ABCD Center is cited at DePaul and has great influence. Oh, thank you, Dr. Johnson. I appreciate it.
I have a question. I'm sorry, Ms. Fatima. Can I intrude or?
Yes, Luma.
First of all, I just want to say thank you so much, Brother Nasser and Mushira, for all of your information. Amazing work. And I just wanted to ask that when it comes to like the honesty and the trust, it's something that I'm really looking into currently right now with my studies. When it comes to like the implications or how to critique it regarding conflict management, we're looking at like issues of emotions sometimes. So sometimes when there's a lot of different emotions or different perspectives in the room, everyone wants to save face, you know what I mean? Or if there's ambiguity or uncertainty about a certain topic, each person knows something different. So we've been taught to always, you know, when in doubt, first begin qualitative research by even just creating forums, right? Try to have people start talking, even if it's not something that's going to sound great at all. And through that talking, you'll start getting towards the truth. So I just want to ask you, Brother Nasser, what other resources do you recommend when it comes to like those really hot situations where it's difficult for people to say the truth? And honestly, Brother Nasser, there are scenarios where the truth can cause more damage than is already there. Where some people, for example, refuse to kind of share information that's personal to them. So that can be seen as not being truthful. So I just wanted to see, Brother, what other resources or advice can you provide us for people that are practicing in the field that really, really want to develop groups and people, but it's just so hard sometimes when it comes to those really hot situations. And what would you recommend?
Actually, what you're asking for is a very tall order, especially in professional life where people have very strong belief systems and very strong opinions. My suggestion is focus on trust than anything else. And once that trustworthy relationship is there, over a period of time, one of the things which I have found in my personal way of managing people is that you start from the point of sincerity. Again, there's a beautiful book. If you get a chance to read, it's called Good to Great by Jim Collins. And in that book, he talks about level 5 leadership. And in there, he says that practicing humility with resolve is one of the greatest signs of people who create change as leaders. So the conflict comes once the egoistic management is there, that I'm right and you are wrong, and being humble that I want to learn from you. There's this excellent article I read today on the net. It said that rather than saying this is how it is, say, well, this is what I think. Can you suggest how I can improve this idea of mine? So you disarm the other by asking this support in what you're trying to do, rather than making your point. And over a period of time, what you will find is that everybody has a piece of truth in their thinking. Mm-hmm. And that pieces of truth in the thinking, when you're able to combine them, they will create far greater synergy than your piece of truth. I don't know if that makes sense to you.
No, it does, brother. Thank you so much. I appreciate it. And I really love the examples that you provided with the specific wording sometimes and how you frame the issue and then how you kind of come back. We've been taught a lot where they want us to start with inquiry, like you're saying, that humility portion. Even if you know for a fact, you know, this is so wrong or this is right, you said it. Like sometimes you just have to listen and find truth even within the midst of something that looks very wrong. And thank you so much, Brother Nasser, for that. That was perfect.
But sister, the resolve has to be there to create value or synergy from listening to other people and looking at their point. That resolve is very powerful. It's most of the time when people practice humility, they say, okay, you can drive roughshod over me. This resolve is so powerful that it kind of stands there, and the humility says, I'm willing to learn. And there's this beautiful Japanese or Chinese quote that if you want to learn something, you have to empty your cup. So this humility is that you come with an empty cup and you say, okay, I know a lot of things, but let me learn from this guy. You know, he or she has a little bit of truth. And then the more you seek, the more you're able to put things together and create something unique, which is what research is all about.
Mm-hmm. That's true. Thank you, brother. That was amazing. Appreciate it.
Welcome, sister.
Hi, this is Nancy. Can you hear me?
Yes, Nancy.
Yeah, I wanted to build on that conversation. I really have enjoyed the presentation so much. And the topic of practicing humility, I think, also plays into the concept of power and who is powerful in a situation or in an organization, and creating a tone where the humility is not punitive. So that when you talk about asking more questions and going into the inquiry, I think setting that tone of humility where no one feels like they're backed against the wall to understand what is preventing them from being truthful. Because I think that's something that I've been exploring over the last couple of years, working with Pakistani communities and coming from a Western mindset. I'm a nurse, and nurses are one of the professions that is trusted the most because of, I think, our position at the bedside and how we help to translate. But to understand the reasons why people are not telling the truth and how to turn that around. And I really liked what you said about humility, but I think it's also a concept of where people see themselves in the hierarchy of the organization, which people in positions of power might not even recognize that they're feeling that sense of, feeling like they have to prove themselves to somebody who's in authority, so they don't tell the truth because maybe they want to look good or maybe they wanted to do the right thing. But I think the lines have become so blurred that we really do need to step back and go take some steps back to go into that place of humility. And I just think it's an interesting conversation today. And thank you. I'm going to go back and read some of these books.
What you're saying is very powerful. My only challenge is that in this whole universe, there's just one person you can control. And even though you cannot control your boss or your reportees or your peers or customers, but you can always control the way you interact with others. So my whole presentation is based on not what others should do. It is what I should be doing with others. Because eventually, if I am able to build that trust, there'll come a point when if somebody comes and says that, hey, listen, how did you do it? So the process should be there clear in my mind. And because without process, it's very difficult to share with others how to create this trust.
Mm-hmm. Yeah, and I think it does also sets the example so that next time, people might re-examine.
Yeah, and like you mentioned that your position as a nurse is so powerful, even though in the hierarchy of healthcare, you may be like after the owner of the hospital and the board of directors and the managers and the doctors. But because of your relationship with the patient, if you are trustable, then, I'll give you an example. I recently had COVID and I was in a hospital and the doctor was not coming in the cubicle. He was just wave his hand from outside and prescribe. And there was this one particular male nurse I was on oxygen, highest level of oxygen I could get. And he said, well, if you really want to get better, we have to bring your oxygen level down. And I was on 15, whatever. And he said, tonight's goal is you have to go on 10. And I said, what is he talking about? I can't breathe. He says, you have to try. And then you put me in the prone position, which is on my stomach. And he said, now you start visualizing, you have to go on 10. And, that confidence that nurse gave me was so powerful that by the time his shift was over, I was on 10. Next day, he brought me to 5. The third day, I was in 3 and out of ICU. I cannot forget that man from my mind. Mm-hmm. So and he was the only one. There were 10,000 other nurses floating around. He was one person who forced me to start thinking about numbers as goals rather than numbers to be scared of.
Nice. And I just wanted to revisit what you had said at the beginning about the hierarchy, because you also spoke about how people are called to different work because of their characteristics.
Yes.
Because I have been a nurse for many years. I took a clinical position. In my mind, it was a step down because I was away from the patients.
You know, there's this there's this hierarchy of what do they call it? There's a map they have for the hospital in which the CEO is on the top, and then there's the hierarchy of the heart,
Right.
and that is dictated by your passion. And I can understand where you are coming from, sister. I mean, I respect you for that, because very few people have the courage to make that decision, to step down, to step up on their passion. And may Allah make it easy for you, inshallah.
Thank you again. Any more questions?
Thank you so much, Dr. Nasser, for your very much. Really like your presentation. I have one question for you. How can we make trust for those who doesn't want to trust you and doesn't want to forgive you?
Sister, this is something which is the most difficult, but there is this dua of Nuh alayhi salam, Rabbi inni maghlubun fantasir. When I meet somebody like that, that's what I recite. And Ya Muqallibul Qulub, that Allah can change the hearts of people. And what I do is I actually pray for them, because it is the weakest position in the world is when you don't want to be trusted. And, you know, it's not easy living in that situation. So you have to pray for them, not pray for yourself, but pray for them, that Allah subhanahu wa ta'ala, please make it easy for them. The happiest people are those who have trustable relationships. And when one person decides he doesn't want to be trusted, or she doesn't want to be trusted, then you have to really pray for them. And remember, prayers are very powerful. And Allah subhanahu wa ta'ala is so powerful. If he wants, then he will make changes. He will make things happen. So, but it's not your game, it's Allah's game. Your game is the only thing he will ask you on the day of judgment is, did you make yourself trustable? That's all. That's what you're answerable for. You're not answerable for if the person you're sharing this about was trustable or not. That's his game or her game. So be very clear in your mind. You know, one of the things during COVID, what I learned was that we make people the center of our universe. And in the end, people are human, they hurt us. The thing I learned was that Allah subhanahu wa ta'ala is the center of the universe. And if you understand that and make him the center of your heart, your love, your affection, your care, then he says so clearly in the Quran that he won't let us down. He won't, he'll make sure that we are protected in this world and the hereafter. So just make him the center and let him take care of these people who you are sharing with us about. He'll fix them. Does that make sense?
Yes, thank you so much. Grateful
Welcome.
for you.
So connect with Allah subhanahu wa ta'ala, talk to him. I mean, tell him the same problem, say this is my problem and find me a solution. For solution finding, there's this beautiful dua attributed in the Quran to Hazrat Musa alayhi salam when he was faced with the river, water body, and at the back were the forces of Pharaoh, and his Hazrat Musa alayhi salam's the chief said, Musa, you have got us into a trap. And Hazrat Musa alayhi salam is quoted in the Quran as saying, Kalla, never, inna ma'ya rabbi sayahdeen, my Rabb is with me and he'll show me a way. So that's another very powerful dua of finding a way out of a situation where you feel you are trapped. So revert to Allah subhanahu wa ta'ala, talk to him in English, Urdu, Punjabi, whatever your language is, and make sure that you are coming from a position of sincerity, honesty, integrity. Also, talk to this person about his or her strengths, that what you find good in them, regardless of how weak we are, we always have some very good things, all of us. And if you start identifying them, that is the bridge that helps us in developing trust. So you can try that, and over a period of time, inshallah, may Allah subhanahu wa ta'ala make it easy for you, things will become better.
Inshallah, I definitely will. Thank you so much again.
May Allah make it easy for you. Thank you.
Jazakallah.
Assalamu alaikum. Wa iyaakum.
Salam.
Mr. Fatma, thank you very much.
Nazir, this is Inamur Rahim. If you have a second,